But Dr. Talley, what are the factors that cause TMJ? Is it genetic? Is it physical?
It's a very good question because that's the fundamental foundation of everything I do. I'm a why person, so I like to operate and base my practice on fact, not on opinion. And we look at the facts of science and anatomy as to what goes wrong with this system that would lead someone down a path of symptoms and problems. The number one thing is a misalignment of the jaw to the base of the skull. This is a situation that's and maybe this would be a good opportunity to use little Albert here. This is a little plastic model of a skull. It looks kind of like an old friend or something, but it's just a plastic model of a skull. And it shows us some relationships. There's 22 bones that make up the skull, and then there's one bone that's the lower jaw. This is the mandible. And the lower jaw is connected by ligaments and muscles and tendons to the head, and it has a little socket right back here that's right in front of the hole in your skull for your ear. And that little knob or ball that sits in that socket at the back of your cheekbone is the articulation called the TMJ, temporal mandibular joint. So this structure has far-reaching effects on the eye, the side of the head, the ear, the jaw itself, the teeth, and your neck, because they all have to work together to make this system work. And when it gets out of balance, which is the fundamental problem, no matter how it gets there, it could be your bite, it could be trauma, a soccer ball blow to the side of your face, a fall down a stairs, a motor vehicle accident, all types of strains and injuries. But something triggers this. Children, as I frequently say, have tricycle wrecks at age 3, and they fall off and hit their chin on the sidewalk, and you can change the growth of that joint by something as simple as that. And nobody knows it because the child gets over it unless they break it, and they do fine and they get along fine until they're in their teens and now their joint starts to pop or click or give them trouble. So this articulation of the lower jaw to the skull is the foundation, and correcting that articulation is the way you treat it, and you manage it with several techniques along the way.